and the coming need for critical care beds and ventilators? Has the state had to err on the side of being more strict when issuing public health orders because of lack of data?
This is Scott Bookman. So we know that nationally there has been a lack of access to testing in the initial phases of this outbreak. That lack of information has certainly made it more challenging to contain outbreaks throughout our state. We have been able to use modeling data, looking and seeing what's happened in other states and in other countries to try to understand what the future may hold for Colorado. That is informing our surge care planning, and it is also informing the governor's decisions on executive orders and public health orders.
This question is from Marianne Goodland. Is CDPHE considering adding recreation retailers to the list of essential businesses?
Adding what are they?
Recreation retailers.
No.
This is Rob Lowe. When will the state have widespread testing? I think we're going to address testing later on, so we'll address that later. This is from John Ingold at the Colorado Sun. How did the Crimson Contagion training exercise prepare the state to respond to this pandemic? What did the state change in its pandemic plan as a result of the training? What challenges has the pandemic posed that the state did not anticipate in prior trainings?
So at the state level, at every level, we all learn a lot of things from exercises. I think what we are learning in the state of Colorado and across the nation today is that a lot of our plans assume that there would be surge capacity and assistance coming in from other areas. What we are realizing is that when a pandemic hits everybody all at once, those planning assumptions are no longer true. And in every state across the country, we are now working within our states with our healthcare partners, with our local public health agencies, with our emergency managers to ensure that we are utilizing all the resources at our disposal at the state level to prepare for what is coming.
And that was Scott Bookman. This is from John Herrick. How is the state deciding what information not to release to the public, such as the specific locations of residential and non-residential hospital healthcare facilities where there have been COVID-19 cases? John Herrick is with the Colorado Independent.
Mike Willis, we are being as transparent as we possibly can be. There are locations that are under investigation. It's important to complete those investigations so that we can release comprehensive and factual information and not not end up accidentally feeding inaccurate rumors or fear. So it is important to do the investigations and then be very transparent with what we learn.
This is from Vinny Del Giudice at Bloomberg News in Denver. Have any hospitalized patients been discharged?
This is Scott Bookman. I don't have that information at my disposal at this time.
This is from Ellis Arnold at Colorado Community Media. Generally, will local law enforcement and state law enforcement be conducting any road checkpoints or pulling over drivers or pedestrians to enforce the state's stay-at-home order?
This is Mike Willis. I think the government made it very clear we all have to do our part. Voluntary compliance is absolutely the right answer here. We really encourage that. And I think that's the big thing here, is for all of us to do our part, for us to encourage our neighbors to do our part, not ask our law enforcement to do that for us. We need to do that for ourselves, for our neighbors, for the people we care about. I think the government made that very clear. I just reiterate his position on that.
This is from Luke Runyon with KUNC. How soon in the data could we start seeing a dip in hospitalizations and cases due to the stay-at-home orders?
We anticipate that it takes several weeks for us to see the impact of social distancing on our numbers. So we will not know for quite some time whether and what impact the social distancing and the stay-at-home order has had on total cases. And that was Scott Bookman.
This is from Dan Mika at BizWest Media. We've seen reports from other states that there are delays in reporting new infections and deaths due to how local health departments may be lagging behind on reporting. Is there any indication that this is happening in Colorado? And if so, to what extent?
This is Scott Bookman. There is no indication that that is happening in Colorado. Prior to the beginning of this outbreak, novel coronaviruses had always been a mandatory reportable condition to the state public health department within 24 hours of diagnosis. And as other labs have brought that testing online, they have provided us with information in that timely manner.
This is from Sam Tabichnik at the Denver Post. We're hearing from a lot of people concerned about the lack of social distancing in grocery stores, even as companies try to take steps to address it. What role does the state have to play in regulating that? Will county health departments be called upon to regulate what goes on in stores?
It's Mike Willis. We are certainly in the discussion with the grocery store community about the ways to protect their employees and ways to protect their patrons. I don't know that we are at a point right now where we would take some regulatory step, but we are certainly working closely with them to ensure the safety of both the people that work in these stores and the people who go shopping there.
Luke Runyon from KUNC asks, would you classify the numbers of people showing up to Colorado hospitals with respiratory illness a surge at this point?
This is Scott Bookman. Well, we have seen isolated pockets, particularly in our mountain communities, where we would have called it surge. At this point in time, we have no evidence that in any area of the state are we truly seeing a surge that is having a negative impact on the healthcare system.
Ellis Arnold with Colorado Community Media asks, Polis's executive order on the stay-at-home says, nothing in this executive order prevents a local public health authority from issuing an order more protective of the public than this executive order. Does the state's stay-at-home order supersede all portions of county stay-at-home orders that are less protective, less restrictive than the state's?
It's Mike Willis. The executive order essentially becomes a law in Colorado. And so while local communities can be more restrictive, no community could be less restrictive.
This question is from Forrest Wilson, freelancing for the Colorado Independent. By my count, Colorado has now received enough PPE equipment from the Strategic National Stockpile for 2 full days of statewide operations. How many days of equipment does a state need to have to meet the needs of a severe infection scenario? Can you give us a timeline of when we might have that amount of PPE equipment?
It's Mike Willis. I think there's a couple of ways to get at that question. First, the Strategic National Stockpile has sent two pushes to the state, and we'll receive a third push probably next week. And we've always known it wasn't going to be enough, and are working diligently to acquire PPE through other both private sector sources and public sources. It's very difficult to predict specifically how much we'll need, but the real objective is to get the supply chain up and running so that regardless of the total number, the supply chain can meet that demand. That's really what we need to do, is get the supply chain up and running to supply all our healthcare facilities.
This next question is from Blair Miller at Denver 7. How many cases does CDPHE estimate Colorado truly has? How far behind is the data we see every day? Do you believe it is in all Colorado counties?
This is Scott Bookman. The data that goes on the website reflects the 24-hour period prior to when it is posted. We don't have a true estimate at this time of how many times more cases we have in our community compared to our laboratory confirmed cases, though we all do believe that there are certainly several thousand more than we have reported at this time. And it would be inappropriate to speculate on whether we had spread in every county at this point or not.
This question is from Rachel Smith with KCNC. The statewide stay-at-home orders list of exempt industries is vague enough to where we've heard of several companies who wouldn't really classify as essential are finding loopholes and are still forcing their employees to go to work. Many employees are concerned for their health because they're going into crowded offices and work areas where they don't feel safe. Does the state plan to amend its public health order with further classifications about what is and isn't an essential industry?
It's Mike Willis. Well, again, that's really unfortunate to hear that people are looking for loopholes in what is really for the good of all of us. So I'm disappointed to hear that companies are doing that. We will reevaluate the effectiveness of this order continuously, and certainly if we feel that it is not having the necessary effect to flatten the curve, then the governor will certainly consider taking additional actions. But I go back to the absolute need for all of us for voluntary compliance. And it's really unfortunate that an employer would put their employees in that position.
This question is from Ellis Arnold with Colorado Community Media. Another part in the executive order references a process by which a local public health authority may obtain relief without burdening public health resources in other parts of the state. Does this mean local public health departments can opt out of the statewide stay-at-home order if they can prove that doing so won't burden other parts of the state with their patients?
No, Mike Willis, no, it does not mean that.
This question is from C. Vanderveen. As of last count, how many facilities in the state were reporting anticipated ICU bed shortages in the next 24 hours? And how many facilities reporting anticipated running out of PPE within the next week?
This is Scott Bookman. I don't have those specific numbers in front of me at this time. We do know that all of our healthcare organizations are working diligently and are working collaboratively amongst themselves and with the state to build out as much capacity as possible. We are working on identifying other healthcare facilities where we can move patients if we need to. We are continuing to work with our innovation response team to identify all sources of PPE so that we can continue to supply our hospitals with the tools that they need to take care of patients.
This question is from Kevin Vaughn. Can you talk about the lag time between a COVID-19 death and the public reporting of that? And specifically whether at any given time the death count is likely lower than reality?
This is Scott Bookman. So there will always be some lag time in reporting. The state has gone to a system where we update our numbers once a day so that everybody just has one place to go to identify that information. In some cases, there will be investigations to really determine what the cause of death was that could result in a slight delay in the reporting of that information.
This question is from Mary Shin with the Colorado Springs Gazette. Will hospitalization numbers be updated as residents recover and are released?
We're still Scott Bookman, sorry. Yeah, we're still very early in this process. As we start to see more patients released from facilities, We will identify the best way to report who is still hospitalized, who has been released, so that we can inform the public.
This question is from Jensen Worley with the Denver Business Journal. Do you have an update on the progress made by the Innovation Response Team? How are they doing on additional testing and new equipment?
Mike Willis, yeah, we get, in fact, daily updates from that team. They're integrated into the Unified Command Center here at the State's Emergency Operations Center. And I think the question as to how they are doing, I think they're making really important progress with some really thoughtful and creative approaches to this pandemic.
This next question is from Jensen Worley with Denver Business Journal. What is the status of additional supplies, ventilators, PPEs, hospital protective gear from the stockpile, donations, and other sources?
Mike Willis, I think the easiest thing to enumerate is what we've gotten from the stockpile. We've received an additional 49,920 N95 masks, an additional 117,500 surgical masks, an additional 21,312 face shields, an additional 20,820 surgical gowns, and an additional 108,000 sets of gloves. We have received quite a number of donations, which are being inventoried and added to the list, and we will begin here pretty shortly to receive PPEs purchased from the private sector, and we will inventory and account for that as well.
This question is from Megan Heiler with KKTV. Do people who are essential workers need a permit for proof if they get pulled over when they're out during the stay-at-home order?
It's Mike Willis. Many of our essential workers already have badges or identification that shows where they work, and those will be sufficient. An essential employer can issue a letter to their employees articulating that they in fact work for one of the essential services, and that will be respected. Again, this is all really about voluntary compliance, and it's really about doing the right thing for each other.
This next question is from Chris Biddle at KVUT. The governor's order last night sent a wave of confusion through Gunnison County where similar orders were already in place. Did the state communicate their plans to any local governments about their plans to issue the order?
As Mike Willis, we work diligently to stay in contact with local jurisdictions and local elected officials.
This is from John Herrick at the Colorado Independent. Has there been a positive COVID-19 case in any of the state's jails or prisons?
This is Scott Bookman. I'm not aware of any at this time.
Aaron Udall at the Fort Collins, Colorado. Does CDPHE plan to track numbers of people who've recovered from the virus? I think we've already addressed that. Thanks, Aaron. This is from Rachel Smith at KCNC. Are you concerned with the integrity of the test results? The U.S. Centers for Disease Control and Prevention has not disclosed how sensitive the test is to detect very low levels of the virus. Is there a problem with false negatives?
This is Scott Bookman. We don't have any concerns at this time about the efficacy of the testing. Regardless of that, what we do know is that COVID-19 is moving across our country, it's moving across our state, and the best thing that anybody could do who has symptoms of COVID-19 is to isolate at home, seek medical care if needed, and ensure that you don't expose others, don't expose yourself to others until you've been fever-free and symptom-free for at least 72 hours.
I want to acknowledge we got a question from Megan Heiler at KKTV about the number of ventilators in Colorado, and I believe we've already addressed that today. Okay. All right. So we have about 6 minutes left, and I know that we promised an update about testing, so I want to go ahead and allow that update to happen now.
This is Mike Willis. We have opportunity here in in Colorado to take advantage of a federal program through the Health and Human Services that is providing test kits and PPE to conduct testing on our healthcare workers and first responders. And so we've begun implementing that program this week, and through next week we will be testing healthcare workers and first responders in 3 locations across the state, one in the north, one south, and one on the western slope. This is a great opportunity. This is a good program to help us absolutely protect the most critical component of the healthcare system, and that is the people in it. And the longer we can protect those people, the stronger our healthcare system is, and the longer it can last, and the more capable it is when the surge comes. And so this is a great program. Really excited about having this opportunity to test our healthcare workers and our first responders. I think this initially starts with about 5,000 test kits, and then we hope to receive another 2,500 test kits sometime next week so that we can continue this program. It is not, and I think it's important to talk about this a little bit. It is not a program for our community members who are not healthcare workers. It is a program specifically to care for our healthcare workers so that they can care for us. And we're working concurrently on other strategies to achieve mass testing. We will bring those programs online just as rapidly as we can. But this is a key piece of protecting our healthcare system.
Okay, great. And it looks like we did get one follow-up question about the testing. How many will we test under the program? Do we know that?
Right now we have 5,000 test kits. I anticipate another 2,500 coming next week. Then I'm not sure. Certainly we're working closely with Health and Human Services to get more, but that 7,500 is what I can say today.
Great. All right. Well, before we end the call, could you each just state your name and title and spell your name one last time?
I'm Mike Willis, W-I-L-L-I-S, and I'm the Director of the Office of Emergency Management.
And this is Scott Bookman, SCOTTBOOKMAN, and I am the Incident Commander for CDPHE for COVID-19. And I do want to take one final moment with this group to acknowledge something. We have all had the opportunity to talk multiple times over the last several months. Some have noticed and commented on a cough that I have from time to time. Due to Colorado's dry climate, I have had this cough for as long as I can remember. I'm not sick. I don't have a fever. I'm doing just fine, and I thank you all for your concerns about me.
All right. Well, thank you everyone for joining us this morning. Have a great day.